Hi everybody and welcome back. Today we're going to be addressing the most common cancer that affects women, cancer of the breast. By age 80, 1 in 8 women will be diagnosed with breast cancer. Despite the high incidence, only 1 in 36 of these women will actually die of their breast cancer, which means that as a women's health specialist, taking care of these women after their diagnosis is a big deal. 75% of women will use a combination of both conventional and integrative modalities in their care and treatment. Breast cancer is not a single disease, but a collection of diseases with different etiologies and risk factors. Things that predispose women to breast cancer include inherited defects in the DNA repair capacity, changes in the signaling pathway for sex steroids, inflammation, nutrient-sensing pathways, and energy balance. Insulin resistance is indeed a risk factor for breast cancer. Having a BMI greater than 30 is associated with an increased risk after menopause, and that's more than 2 out of every 3 women. Central fat mass around the organs is where the biggest risk lies, and it can be easily missed, especially in people of Asian descent. Being a normal size does not mean that you aren't obese on the inside. Do you know how much visceral fat you have? Obesity is also associated with worse survival after diagnosis, especially in premenopausal patients. Optimizing insulin sensitivity with proper nutrition, increasing physical activity, and controlling stress are extremely important in reducing your risk of diagnosis and in recovering from treatment. Current breast cancer screening relies on mammography, but it's not perfect. Depending on technology, a woman's breast density, and other factors, up to 20% of breast cancers can be missed with mammography. Some organizations recommend starting at age 40, some at age 50, usually at an interval of every 1 to 2 years. Any woman with more than a 20% lifetime risk of breast cancer should consider supplementing screening by use of breast MRI. Due to the radiation exposure associated with mammogram screening, many patients ask for an alternative method. Breast thermography uses infrared rays to show pattern changes in body temperature. The scan is then interpreted by a thermographist. The issue with thermography, it is only detecting changes in the surface blood flow. So if you have a cancer that's deeper, you likely won't detect it unless it's grown so large that it's recruited a blood vessel big enough to disrupt skin flow. In fact, thermography only detects 25% of known breast cancers. At this time, digital 3D mammograms still remain the gold standard in screening. Other modalities like molecular imaging and PET scanning are used in staging and follow-up, but still come with the risk of radiation exposure. You need to understand what your individual risk is and choose the method that you feel most comfortable with. To reduce your risk of diagnosis or to adjunct treatment for breast cancer, we should focus on the most important pillar of our health, our nutrition. There have been 3 large trials looking at low-fat, high-vegetable diets to reduce the risk of breast cancer recurrence. The WHI, WINS, and WHEEL trials found no evidence that adoption of this dietary pattern prevented recurrence or death, despite the fact that these women were being repeatedly told to avoid saturated fats. When women replace animal fat in the diet with vegetable oils, it increases their risk of cardiovascular disease, something that's more likely to kill them than breast cancer.
Let's hear that again.
When women replace animal fat in the diet with vegetable oils, it increases their risk of cardiovascular disease, something that's more likely to kill them than breast cancer. Women should avoid inflammatory vegetable oils, refined grains, and sugar, and eat nutrient-dense animal foods, including fish, high in omega-3 fats like EPA and DHA. Did you know that the Women's Healthy Eating and Living trial found that carbohydrate restriction was associated with a striking 5-fold reduction in breast cancer recurrence, specifically in patients whose tumor was positive for IGF-1, or insulin-like growth factor? Unfortunately, no one is testing for this in the tumors, and no one is talking to patients about carb restriction as an adjunct to their treatment. Another great tool is caloric restriction or intermittent fasting. Numerous studies have shown that these methods inhibit cancer and cancer progression. In fact, repeated short fasting cycles are as effective as chemotherapy in delaying progression of tumors in animals. In human studies, fasting prior to chemoradiation also mitigates side effects and it sensitizes the tumor for destruction. To follow the latest research, make sure that you check out the Keto Care study being conducted by Dr. Jeff Volek at the University of Ohio. For more than 2 decades, Dr. Volek has published dozens of studies showing that the ketogenic diet uniquely benefits patients with obesity, metabolic syndrome, and type 2 diabetes. This trial is the first rigorously controlled study looking at the effects of nutritional ketosis in women with advanced cancer. You're going to hear it over and over and over on this channel. We need to get back to the basics. Nutrition, exercise, sleep, stress, and environment are the controllable factors when it comes to your health. Principles behind the integrative approach to breast cancer prevention and recovery include minimizing insulin resistance, decreasing inflammation, avoiding exposure to environmental chemicals and xenoestrogens, controlling your stress. Thanks so much for watching today. If you have any experience with this, please feel free to comment, ask your questions below, like this video, share it with your friends, and please subscribe to our YouTube channel so that you can see our future content.